Good afternoon, everyone. Today we have Mr. Matson here, and he's going to be speaking to us of what it's like to be a pharmacist. What has his education been like? Any degrees he's obtained, or any additional certification he's acquired throughout his lifetime, and then also he'll share with us his daily work routine, any highs or any lows that have kind of come his way. Also, how has COVID-19 impacted his daily routines in pharmacy. We ask that you mute all lines. If you have any questions that you'd like him to address, please feel free to put that in the Zoom chat box and he'll address it as necessary. Once again, please be respectful of everyone's time. And thank you for joining us, and thank you for being here, Mr. Matson. We appreciate it.
Okay. My name is Chuck Matson, and this is my wife, Kenda. She's going to help me if I have some technical issues. I've been a pharmacist for 40 years. I'm currently employed at Citizens Medical Center here in Victoria. I've also worked at retail pharmacy, and I've done consulting for nursing homes or long-term care, geriatric pharmacy. I have a certification in geriatric pharmacy. And I was introduced to pharmacy through my uncle, who owned a pharmacy here in Victoria years ago. Yes. When I was in high school, I worked as a delivery person after school for him for a couple of years. Pharmacy profession can be very rewarding in that you're able to help people. Can also be disappointing when people are not happy with what you have to tell them to. Post-high school requirements have changed a lot since I went through pharmacy school. At the time I entered pharmacy school, there were only 3 pharmacy schools in the state of Texas. And it was a 5-year program. There were 2 years basics, which I got at Victoria College, and 3 years at the University of Houston College of Pharmacy in Houston. And at that time, you received a Bachelor of Science, and I received that in 1979. There are now 9 post-secondary schools for pharmacy in the state of Texas, and you receive a doctorate of pharmacy. From what I understand, you do not have to have an undergraduate degree to get into pharmacy school, but it does helps you get in. You can apply for pharmacy school after completing your prerequisite courses, which is going to be a lot of math and science. You'll usually at least 2 years of undergraduate school.
So how long does it take them from the time, if I get 2 years of undergraduate, then I enter for my doctorate? How many more years is that?
Be 6 years total. 4.
Okay.
There's 4 in the University of or the College of Pharmacy at this time.
So 6 years total.
So, as a high school student, it would benefit you to take as many courses in science and math as you can. More exposure will make it easier for you at a later date. And a good way to see if you'd like a career in pharmacy would be possibly to work as a pharmacy technician. This choice also gives you points to get into your College of Pharmacy, having experience. Pharmacy tech requirements are a high school diploma or a GED. You also have a background check and need to pass the Pharmacy Technician Certification Board. When you graduate from the College of Pharmacy, you'll find entry-level positions pay around $100,000. As a rule, in this area, there's not really a ladder to climb. Raises come with years of experience and cost of living increases. There are some administrative options where your salary would be increased. The advantage or disadvantage in that field would be that you would not be really doing medical work anymore. It would be more business type and less related to medicine. You can find higher salaries in some of the more rural areas due to demand. So like pharmacists in Austin may make less than some pharmacists in rural areas because a lot of people want to live in Austin. And there is a high demand for bilingual pharmacists in South Texas. And something to consider after you get out of pharmacy would be specialty certification. I mentioned mine is in geriatric pharmacy. There are 13 specialties in pharmacy. Some of them would include like cardiology, critical care, infectious disease, nuclear medicine, oncology. Those are a few of them. As far as COVID-19, it's made our need for protective gear even more important than ever. And if you were a infectious disease specialist at this particular point in time, this would be particularly useful because of the COVID outbreak. We have infectious disease doctors and pharmacists, are given programs all the time on what's the latest and greatest, that's out there, and it changes every day. In a hospital setting, we always wear protective gear when working with chemotherapy. This is to protect yourself because they are dangerous medications, very potent. When you're preparing IV preparations for your patients up on the floors, that's to protect them from infection or germs getting into the medicines that you're giving them. And then with COVID, we pretty much wear the protective gear all the time, everywhere, to protect yourself and those around you. Let's see, and no matter what type of pharmacy that you enter, good computer skills are going to be a real must. Daily orders are entered by pharmacists and nurses and medical doctors, and depending on what type of pharmacy you go into will determine what your average day looks like. In a large hospital, you might work exclusively with chemotherapy every day. There are also clinical pharmacists that round with the doctors and nurses, therapists and dietary personnel, and they go to each patient's room or those under their care, and they put a plan of care together. It's a multidiscipline plan, and that works very well. In our hospital, we wear a lot of different hats. On a typical day, I'll get to the pharmacy and enter orders for medications for the patients up on the floor. And around 7:30 or 8, chemotherapy patients start to arrive, and we have to review the orders for accuracy. And we enter the meds in the computer, and then we have to mix the chemotherapy agents. These are very toxic medications and must be mixed exactly to the manufacturer's guidelines. After lunch, we'll review patients' medical regimens and adjust the dosages of the medicines that they're on according to their kidney function. We also, after lunch, review regimens for interactions and duplicate medications. And then around 4 o'clock in the afternoon, we'll receive preliminary orders for the chemo for the next day. Then we spend a couple hours putting those in and reviewing what we can. Those orders are preliminary, and they may change the next day when they actually show up. 1 or 2 days a month. Since I am a geriatric pharmacist, I go to the skilled floor. This is where we have our geriatric patients and usually a rehab floor, broken hips, physical therapy. Works with the patients there, and all the different therapies work with them there. And a lot of times they're on IV antibiotics for several weeks to get rid of infection or to mend broken hips or broken bones. And so when I go up there, I review their charts and look for the medication to see if the doses are appropriate for the geriatric patient. Usually they require smaller doses in most cases. Um, and then speaking of the skilled floor, each resident that's admitted there must have a pharmacist review their orders within 72 hours. That's a requirement at any of the long-term care facilities. Also during the day, if a stroke or a heart attack happens, there's a code called overhead, and the pharmacist responds to the patient's room, and it's part of the team that works to revive the patient. One other thing that we do in our pharmacy is we fill prescriptions for our employees. So it would be like a retail type pharmacy. Okay, if you work in a retail pharmacy, you'll fill prescriptions for your patients and counsel them the best way to take their meds. Go over them with what time is best to take their meds, what things to avoid, what side effects might occur. Things to avoid might be some medicines make people more sensitive to the sun. They could be have horrible sunburns, just any type. That's just unusual thing, but that would be something that you'd want to let somebody know. Retail pharmacists also give vaccine injections. A lot of them also give special education like diabetes education. Also, you're the person that they will come to for information on over-the-counter medications and herbal medications. You might also do a consulting practice, which usually involves traveling to several different long-term care facilities or nursing homes each month. And there, when you go there, you review the patient's medical records, you look at the for diagnoses for the drugs, you look at the lab work, look at appropriateness of care. One of the other things that you will do is watch medications being passed and help make sure that they're given, in relation to the meals, either on an empty stomach, if that's how the drug has to be absorbed, or maybe with food, if it upsets the stomach. Other things that you would do there would be to help dispose of medications that are either expired or have been changed. They're no longer current. Long-term care facilities are very regulated industry, and one of the things that they want you to do is help them keep current with the regulations that are out there. Other pharmacy fields would include, possibility of research or pharmaceutical sales. And no matter what area that you would decide to go into, you always need to keep up with the changes in the field. There's always new drugs that you need to keep up with, and your computer skills are very important in helping keep up with those.
Okay, I'm gonna ask you some questions.
Okay.
First off, tell them what might be like the hours at different places. Like, for example, what are the hours of a pharmacist at a hospital? Start with the hospital.
Okay. It depends on what you're doing in the hospital, but the hospital pharmacy is open 24 hours a day, 365 days out of the year. So there has to be a pharmacist there all the time. During Hurricane Harvey, you go up there, and that's where you stay for the duration of the hurricane.
That's where he got to stay during the hurricane. I left town.
And so somebody has to be available to work, those graveyard shifts too. So and of course, if you go to retail, I think probably your chain pharmacies are probably, like 8 to 8 or 8 to 9, 12, probably about 12 hours a day. And they're pretty much open 7 days a week. If you'd go with a independent pharmacy, possibly, like Monday through Friday and maybe Saturdays, or maybe, Monday through Saturday or part of the day Saturday.
And then what about like consultant? Well, you mentioned consultant, those hours.
Well, those is hours are Monday through Friday pretty much all the time. And you may leave very early in the morning because you may have a facility that's 2 hours away. So you've got to drive 2 hours to get there. And if they're far enough away, usually you would probably stay overnight if it's more than one day to take care of their needs.
So the time it takes in that facility depends on how many people.
That's correct.
Okay.
So the more, I've gone to facilities with as little as 30 people in it, and I've gone to facilities, where there's a couple of hundred. So each of those will take a different number of hours to get through it all.
So when you graduate from pharmacy school, are you done or you take a test?
You take you have to pass the pharmacy board. There'll be a test there. And
is it hard?
well, it seems very hard when you're taking it.
So you're certified in the state of Texas.
That's correct.
Does certification go across states?
You can apply for reciprocation to different states. And usually what you have to do to most states is you'll have to take their state board, their pharmacy laws, because each state has its own laws, and then there's federal laws too. But there's some states that will not accept reciprocation, and those you have to take the whole board over again.
Yeah.
So used to be New York and California were a couple of states that did not reciprocate, but I'm not sure how many states there are now.
Okay.
Mr. Matson, we do have some questions in the panel, and one of them was that.
Okay.
You need to read the next one?
Oh, that's what I was going to sit and go through them for you.
Oh, perfect. Wonderful.
All right. So that was the first one there. So thinking of things other than high school subjects of math and science, what other classes would you recommend? Or any extracurricular things you should take place in? Is it going to help you to be a well-rounded person to get through pharmacy school and participate in?
Yes, it would. Probably all those being active in your school and leadership skills will always be useful.
That's just helps you get accepted to universities
Right.
as well. Okay.
Right.
But no other specific classes other than math and sciences that you're thinking of?
Well,
You got to pass English. But.
well, yeah, you have to. You'll have to go through all the core courses. English, history. Those are just basics. But math, science, physics, calculus, organic chemistry, and inorganic chemistry, and then you get to take a whole bunch more when you get there.
Yeah, that'll be fun. Next question is, what soft skills do you need? Such as, you mentioned computer skills, and you'll talk about that a little bit more later, but communication skills and that kind of stuff.
Well, it kind of depends on what you're doing, but if you went into pharmaceutical sales, you would need to be it would be best if you were very outgoing type person, and that's just a sales thing.
Do they hire pharmacists in sales, the pharmaceutical sales?
Yeah, they hire several different medical professions. They hire nurses, pharmacists, and I've seen some physician assistants too.
Okay.
So.
Okay.
And of course, if you were doing research, you would need to be able to speak before your group of your peers and explain what you've done and what the expectations for your new drug would be.
Okay. Does even in this computer age where, and I know the people watching see the doctor, they put the stuff in the little iPad when they're talking to you, and the scripted and all that kind of stuff. Is it more important now to be computer savvy, or is it easier now because everything's digital?
Well, it's very important to be computer savvy. A lot of times we look on those chemotherapy regimens. They're not all just straightforward. Sometimes you have to look pretty hard to find where the regimen's coming from. And computer skills, I find especially the younger pharmacists are able to find those much more quickly than I am.
So you're having to research it? Is that what you mean when you say the regimen? I don't know what that means.
Yeah, well, basically they're treating lung cancer. There is a set of medications that has been proven to work, and a dosages for each of those medicines. And one of the things we do is we look to make sure that there is some history that this is actually works.
So it is some of a research thing. Then.
Yeah.
Okay.
And some of them are hard to find, some of them aren't. One of our oncologists, he puts at the bottom of his orders where a site for where you can find it. And that's unusual, but that makes things a little easier.
So going back to the original question, yes, computer skills are extremely important.
Yeah, yes.
The younger people do better than you
Yes.
in that area in your group. Okay, next question. How inclusive is the career field? Gender?
I think there's probably more women than men in our, or pretty close to 50-50. I'm not sure.
Yeah. Was it like that when you were in pharmacy school 40 years ago?
It kind of was in that general area.
So even
at that
then?
time.
Okay.
Yeah.
Okay.
You know, it works. It can work very well for a mom. You know, it's a decent.
It's a job you could work part-time if
Right.
you wanted to.
And you get a decent pay.
Yeah. Okay.
And
What about somebody with a disability, such as physical disability? Is that something you think about? Obviously, we're not going to discriminate, but
yeah, it could make it harder in some respects. I would think it would be very difficult to go to a code. You know,
yeah, physical disability.
yeah, because sometimes there's like 10 or 15 people in the room, and it's just.
But if you're more selective on where you worked, then
Yeah.
maybe.
Yeah.
Okay.
Yeah. So there'd be many opportunities for somebody with physical disability, but not all. You know, they wouldn't all be.
Open. Okay. Continuing education. What do you have to do for that? Do you have to do anything to keep your license up every year?
Yeah, it's every 2 years, and we have to do like 30 hours, and then some of them have to be, if you do IV medicines, a certain amount has to be that. There's a certain amount now. There's one out for opioid abuse, so that's an hour that you have to do there. You'll have to do some for law, and then if you're a preceptor or something like that, then you've got several hours of that. As far as like for my geriatric certification, I've got to get 75 hours every 5 years for that. And if you get another specialty, it'll probably be somewhat similar to that.
So I have to be renewed every 2 years. But do I have to have a specialty? Like you have a geriatric?
No.
You don't have to have a specialty to practice.
No,
Okay.
I think there's only one other person that has a specialty where I work, and it's in therapeutics.
So every 2 years, and how do you get your continuing ed? Do you have to go somewhere? Is it all online now?
There's a lot of stuff online that's free. The stuff that I do for my geriatric certification is available through the American Society for Consultant Pharmacists, and it does cost money to continue that.
Everybody always has to remember too, renewing those licenses costs money every 2 years. They don't just hand it out to you.
No.
Another good question is explain the difference between a pharmacy tech and a pharmacist.
A pharmacy technician does a lot of the same stuff that I do, but they do not have, they don't have a license. So they're working under the pharmacist's license, and they prepare most of the meds. They do computer entry. They stock the machines up on the floor for the patients. They do almost everything. And they make a lot of the chemotherapy, even as far as they do not do the checking of the regimens, but they do make the physical medicine.
So they can do a lot of work, but in the end, the pharmacist has to check off to make sure it's done.
That's correct.
Before it can be sent on to either. And so pharmacy techs work in hospitals, retail?
Yeah, retail. Hospitals, there's a lot of, there's more options. They can work in the IV room. We have technicians technicians go upstairs, like I said, and stock all the machines on each floor with medicines for the patients. They actually know more about those machines up there than I do.
Talk about the machine. When you said machines on the floor, I don't know what that means.
There's something called a Pyxis machine up on the floor, and the nurse goes to that Pyxis machine and punches in the patient's name, and there are medications that are available for that. You know, a drawer opens and they pull out the medication that's for that patient.
Okay, so they go up and fill those machines.
Right.
Gotcha. There are some pharmacy tech. Are there schools? Are there programs? Or
I think there are
classes?
some classes for that. I don't know that, as far as I know, that's not a requirement.
Yeah, because I know in a hospital in this area one time had a course you could take and to do some pharmacy tech. But did you say Victoria College? Does it ever have?
I'm not sure. I do know that they had a medication aid class there that they asked me to speak at.
So pharmacy tech, I can get that without a degree. I can go do that job.
Correct.
Okay. This is an interesting question from Jennifer. I like this. All pharmacists are doctors, but not all doctors are pharmacists. So explain what a doctor of pharmacy actually means.
Okay. Doctorate means that you've gotten an advanced education. A lot of our pastors in our churches are doctors. They have a doctorate of, what do you call it?
Divinity.
Divinity, doctor of divinity.
It's not like candy, that maybe the wrong word.
Lawyers have a doctor of jurisprudence. So it's usually a degree that is after your 4-year degree. So it's just that you've gone through and gotten quite a bit of extra education.
So as a doctor of pharmacy, can you prescribe medications?
No, not
Okay.
not here in Texas. There are a couple of states that have a limited prescriptive authority, and we can prescribe stuff in the hospital under certain conditions. Like we do prescribe, like some of the antibiotics. They say, well, we want this patient on this antibiotic. You manage it. So there may be certain levels that have to be met. So you order the levels, and adjust the dosages as needed.
Okay. So a medical doctor does the prescribing.
Yes.
Yeah. Did they, how do you say this? They took classes in knowing how dosage was and all that kind of stuff to know how much to prescribe and all that? Or do y'all have to help them out with that? How's it work?
They took classes for that.
Okay.
And usually they have a long, they have some residencies type thing where we talked about going on rounds earlier with, the pharmacists and doctors and nurses and dietarian therapists and all that. It's kind of that's one of the things that, like, medical school seems to do really well, and it brings together all that knowledge. And then usually a doctor is in charge of that group, and he will, may assign you to do research on new medicines for disease state that a patient has. So that would be your, what you're going to go look for over the next day, overnight.
So it's a team thing.
Yes, it's a team thing.
Okay. All right. Let's see. Well, that's the end of the questions. Anybody else have anything they want to tap in or think about?
One thing I do want to ask you is, what words of encouragement do you want to share so a student wouldn't lose sight of the focus? Sometimes, we have distractions with our peers or outside influences. How can you ensure, or what would you do to ensure that you stay focused and don't lose sight of the target?
Well, that does bring up something interesting. Is something my daughter has just gone through. She's a speech therapist now, but one of the things that they told her was whatever you put on the internet stays with you forever. So remember that some of the choices that you make, you can't unmake them. So just keep that in mind. And as I'm sorry, I kind of got
At the
distracted.
school, how do you stay focused and get through it all? Is it
Well,
worth 6 years?
Most days.
Most days. It's, I think you made a good point of it being a you can take care of yourself, you can live independently, you do make a living at it, and it's a job you can do part-time. You can go back and come,
Yeah.
leave the field for a while and come back in, so that's a good thing. But how do you encourage them to stay with those math and sciences? Because that's hard.
It is. You just have to look at the goal and kind of go from, kind of try and make day by day.
Well, remember, how
You
long
mentioned social media and the impacts of that. Now, can you speak of how important a digital footprint is and how a clean digital footprint versus those have gone off maybe a crazy path? How important is it keeping social media clean? And then also to tag on that, how not to share too much for HIPAA, because y'all deal with a lot of confidentiality records and documents.
Good question.
As far as the social media, that can come back to haunt you when they're hiring you. Because if they look under, if somebody wants to look and you've got stuff going on there, maybe behaviors that you're not too proud of, that can stay with you. As far as HIPAA goes, man, the hospital that I work at, we have to go through expectations for HIPAA. There's a healthcare learning objectives every year, and we always have something with HIPAA on it. And you just have to be real careful on that. I mean, we have designated bins that shred bins that everything that has patient information goes into. You just have to be careful with that. And then, of course, you can't be talking about, you might can say something very generic about a health state, but you certainly don't want to mention anybody's name or where somebody's at or anything. Matter of fact, I think they're pretty strict now on even letting visitors in to visit people. If the patient's asked not to be seen, then they don't even acknowledge that you're there. So.
Now, can you say what is the acronym of HIPAA? Can you break that down for folks who don't really know?
It's like Healthcare Information Portability Act, something like that.
Isn't that funny? You don't even know it, right? So he's not supposed to come on and tell me who's in the hospital.
Right.
Right. And so go back to what you said about visitors, because COVID right now is making it so visitors aren't
that's
coming.
True, right. Yeah, they're not only are they not coming, but they're not, they can't come. And that's really difficult right now, because I spoke to a lady just recently, and her daughter was in ICU in another town, and she drove to go see her, and when she got there, she couldn't because of the HIPAA stuff. I mean, no, the COVID stuff. So it's very, and it was unrelated to COVID as far as the reason, the hospitalization, but it's tough. I mean,
So, and then going back, if I said I don't want any visitors, the hospital can't say, "Oh, Ms. Matson's on the 3rd floor."
That's correct.
Okay. There's what it means. Health.
Health Insurance Portability and Accountability Act.
One other question we have, can you explain the difference of an anesthesiologist versus a pharmacist? How do they administer medicine versus how you administer medicine?
Good question.
Anesthesiologist is usually a physician. They can be, there's nurse anesthesiologists also, that they have a specialty in that, and that's their, yeah. But a doctor anesthesiologist would have gotten his degree in medicine first and then would specialize in anesthesiology. So it'd be another couple of years, or I don't know, it may be more than that. And they administer medications usually in the operating room. They decide, you know, and so they're there observing the patient and are able to adjust the medications as needed. Like, you know, if they're not getting pain relief, well, they need to up that. If they're coming out of anesthesia, you know, they need to up the anesthesia dose. But they're right there during the surgeries. So, whereas the pharmacists, you know, we provide medicines to the OR room for them to use, but we are not administering the medication.
You don't measure out how much to give.
Well, usually they come in in vials or whatever, and they use one partial or one or more than one. You know, it just kind of depends on the patient's size, age, and how quickly they metabolize the medicines.
Okay, we don't have any other questions here. Does anyone else on the call have anything they'd like to have addressed by Mr. Matson? With no further comments, no further questions, we want to appreciate you all for joining us this afternoon. And thank you for providing this wealth of knowledge, Mr. Matson. We appreciate it. If you do find yourself wanting to have something answered or addressed, please feel free to email us and we can connect you to him. Once again, thank you all. Have a great afternoon. You all stay safe and stay healthy.
Thank you. Bye.